Helping clients dress and groom themselves supports their independence and self-esteem. This lesson covers how to assist with clothing choices, dressing, brushing hair, and basic grooming routines. The importance of dressing and grooming. Dressing and grooming are essential daily routines that promote dignity and self-worth, encourage independence and emotional well-being, help maintain personal hygiene and skin health, give the HHA a chance to observe changes in behavior or physical condition. Even small tasks like combing hair or choosing clothes can significantly impact a client's confidence and mood. Respecting preferences and encouraging independence. Always involve the client as much as possible. Ask them what they'd like to wear. Allow them to do what they can, e.g., buttoning, brushing hair. Respect their style, religion, and cultural clothing preferences. Offer choices and explain each step before beginning. Example: would you like the blue shirt or the striped one today? Dressing assistance guidelines. When helping a client dress or undress, follow these principles. General tips: ensure privacy, close doors and cover with a towel or blanket. Choose comfortable, easy-to-wear clothes, especially if the client has limited mobility. Dress the weaker or affected side first, then the stronger side. Undress the stronger side first, then the weaker side. Encourage the client to participate as much as possible. Allow enough time, never rush or force movements. Check for tags, seams, or tight areas that might cause discomfort or pressure sores. Dressing a client with limited mobility. Use adaptive clothing if available. Velcro closures, elastic waists. Position the client safely, either sitting in a chair or lying on the bed. Support the limbs gently during movement. Use non-skid socks or shoes after dressing to prevent falls. If dressing in bed, keep one side of the body covered while assisting with the other. Grooming tasks you may assist with. As a home health aide, grooming assistance may include hair care, brush or comb gently, assist with styling if requested, shaving, use electric razor, never a straight razor unless agency allows. Ask about preferences. Oral hygiene, if not covered in other modules, assist with brushing or rinsing, especially in the morning. Nail care, only file nails, do not cut unless certified and allowed by state/agency. Skin lotion or deodorant, apply as requested or per care plan. Avoid scented products if skin is sensitive. Eyeglasses, hearing aids, dentures. Help clean and place them if the client cannot do so alone. Always remember, never perform grooming tasks like nail trimming, foot care, or shaving with a blade unless specifically trained and authorized. Dressing for weather and safety. Help the client choose clothing that is weather appropriate, for example, warm layers in winter, breathable fabrics in summer, easy to remove for toileting needs, safe, avoid long dragging pants or slippery socks, comfortable, loose enough to allow circulation, but not so loose that they trip. Clients should not sleep in daytime clothing unless the care plan says otherwise. Cultural, religious, and personal considerations. When assisting with grooming, it's important to respect each client's cultural, religious, and personal values. Be respectful of cultural or religious attire, head coverings, modesty rules. Gender-related preferences. Some clients prefer same-gender caregivers for grooming. Hair and skincare routines that are specific to the client's background. Makeup or accessories that make the client feel more like themselves. Tip: ask the client or family what is important in their grooming habits. Common errors to avoid. Here are some common errors to watch out for. Dressing the stronger side first causes unnecessary strain and discomfort. Ignoring the client's clothing choices undermines autonomy and dignity. Rushing the task increases risk of injury and anxiety. Using scented products without asking can irritate sensitive skin or allergies. Leaving clothing wrinkled or twisted can cause discomfort or pressure injuries. By avoiding these mistakes, you provide safer, more respectful care that supports your client's comfort and well-being. Observing and reporting. As a home health aide, your role goes beyond helping with grooming. You're also the eyes and ears for the care team. While assisting, be alert for skin redness, bruising or rashes, unusual resistance to grooming, could indicate depression or discomfort. Weight gain loss, clothes fitting differently, changes in hair or skin condition, sores near elastic bands or pressure points. Report all unusual findings to your supervising nurse promptly. This lesson covered the key principles of assisting with dressing and grooming in a home care setting. Support client independence, preferences, and dignity. Dress the weaker side first for safety and ease. Assist with grooming tasks like brushing hair, shaving, or applying lotion. Promote hygiene, comfort, and emotional well-being. Be aware of cultural and personal factors. Report any physical or behavioral changes. Provide respectful, patient assistance to empower the client. Respectful, personalized care empowers your client and supports their dignity every day. Let's continue to the next lesson.